So welcome everyone, I'm Trevor Hassel. I'll be your moderator for today's official launch of the Healthy Caribbean Coalition's most recent report titled NCDs and COVID-19 in the Caribbean, a call to action, the case for a transformative new NCD agenda. This report has been made possible by a grant from the NCD Alliance Civil Society Solidarity Fund on NCDs and COVID-19. Today's webinar, for which I see some more than 300 persons have registered, it will take the form of an overview of the report. This will be followed by a moderated panel discussion on perspectives on a transformative new NCD agenda by Caribbean thought leaders, after which the webinar will conclude with a facilitated open discussion. Before we proceed further, please note that the webinar is being recorded. And lastly, please use the chat box for questions or comments. The rationale for the report, which we will be sharing and discussing, is based on the fact that the occurrence of the COVID-19 pandemic has and continues to significantly threaten the lives and livelihoods of many in the Caribbean, a region with an increasing proportion of older people and high NCD prevalence, comorbidities which adversely impact COVID-19. At the same time, the pandemic has heightened awareness of many determinants of health and exposed for-profit industry tactics that are really largely at odds with the achievement of public health objectives. The pandemic has revealed inequities and shortcomings in implementation of comprehensive national responses to NCD prevention and control. And it has particularly adversely impacted people living with NCDs and other persons in conditions of vulnerability. It has gone further and slowed the progress in achieving the Sustainable Development Goals. And it's put at risk many of the gains made in reducing premature mortality from NCDs, including those with mental and neurological and substance abuse disorders. The effects of the pandemic and efforts to contain it have disrupted lives and livelihoods, affected supply chains, including for food and nutrition security and health services have been severely affected. Even before the pandemic, the United Nations and WHO assessments of advances towards internationally agreed NCD reduction targets documented a slowing of the progress and an implementation deficit in evidence-based global recommendations. Here in the Caribbean, a 2016 report also demonstrated delays in fulfillment of the commitments. It is therefore against this background that we in the Healthy Caribbean Coalition have produced this report. And I now invite our Executive Director, Maisha Hutton, to provide an overview of the transformative new NCD agenda. Maisha.
Good morning, Sir Trevor. Thanks very much. Let me share my screen. Good morning, good afternoon, all. Okay, so it is quite a task I have ahead of me to condense this blueprint we have for a transformative new NCD agenda into a 15-minute presentation, but I'm going to do my best. I wanted to start with this first phrase, which really encapsulates what we were trying to achieve in the conceptualization of this transformative new agenda. It is essentially a call for empowered and mobilized Caribbean citizens to stand up for their fundamental human right to live in an equitable world where CARICOM governments take responsibility for creating environments that support and promote human and planetary health. Before I get into the details, I wanted to take an opportunity to thank Dr. Beverly Barnett, who rose to the task when we approached her back in July and asked her to help us to formulate this vision and put it on paper. So sincerest of gratitude to Dr. Barnett for helping us to come up with this transformative new agenda. The methods that were used, we conducted a detailed review of international and regional frameworks, work that had been done to date within the context of NCDs and within the context of the pandemic, the responses both at the regional level and the global level. And then we conducted virtual interviews with various stakeholders across the region, including civil society partners, people living with NCDs, young people, representatives of regional institutions, and policymakers. With all that information at hand, we conducted a robust analysis of where we've been, the gaps, the strengths, the weaknesses, to inform the vision for this transformative new agenda. In the end, we came up with a document which we feel not only helps to map out how we can achieve a change in the NCD landscape, but also provides a really excellent resource on what's been done within the context of COVID and NCDs. The final report was reviewed by stakeholders, all of which are on this panel that you will hear from in a few minutes, including other stakeholders. So this image provides a snapshot of the agenda, which I'm going to go through in some measure of detail. The vision is a tangible and permanent shift in the Caribbean health and development environment that promotes equity and human rights and allows people living with NCDs to achieve their fullest potential, contributing to sustainable national and regional development and the attainment of the Sustainable Development Goals. The mission of the TNA is to enable people-powered action. People-powered action, and I think that's so critical. Action that galvanizes bold political leadership and policies for NCD reduction, to address the social and other determinants of health, including commercial determinants, to enhance human security and human capital, emphasize prevention, and enable integrated action across themes, sectors, and disciplines. The overall outcome being a reduction in NCDs, focusing on the 5 major NCDs and the 5 main risk factors. So we came up with a number of approaches, some of which we believe are transformative and others traditional, promoting and emphasizing equity and human rights as fundamental and critical in any NCD program and policy moving forward. Enabling appreciation of mental and neurological and substance use disorders. Encouraging and empowering communities, including people living with NCDs, young people, children, people with disabilities, to really stand up and call for a substantive change in the way we treat NCDs, improving health and digital literacy, promoting research and information systems, promoting analysis of political economy and behavioral economics to really meaningfully inform our interventions, and promoting a shared value and social impact business model. Traditional approaches, accelerating implementation of the WHO best buys and other recommended interventions, a body or menu of evidence-based actions that we know work, but we also know we've been slow to implement. Enabling integrated multi-sectoral health and all policies, whole of government and whole of society partnerships. We have struggled as a global community and a regional community to meaningfully achieve these cross-sectoral partnerships. We have tried with NCD commissions and we've had modest success, and we need to figure out models which help us to achieve these partnerships, all the while managing conflicts of interest. Promoting strong, resilient health systems and universal health, and finally, enhancing accountability. And so we've identified 5 areas of focus. The first priority area, life course prevention, working to prevent NCDs using a life course approach that addresses the 5 main risk factors and emphasizes early prevention amongst children to tackle such major issues and impending threats such as childhood obesity. Social inclusion and participation for policy development. And we can't emphasize this concept of inclusion enough. Meaningful engagement of people living with NCDs and other vulnerable communities, children, youth, other persons with conditions in the entire policy process, and also building a sense of activism amongst this group. Number 3, people-centered, primary healthcare-based health systems for universal health, improving leadership, governance, and resilience of adequately resourced health systems, and offering accessible, client-focused health services that do not result in financial hardship for users, that have primary healthcare as a core strategy and that realize a return on investments in the form of health, a public good. Partnerships, networks, and resource mobilization. This is a critical one. How do we strengthen partnerships? How do we institutionalize mechanisms for partnerships? How do we increase multi-sectoral, multidisciplinary collaboration at all levels, nationally and regionally? And how do we mobilize resources, financing for NCD policies and programs? And our fifth priority area, accountability for decision-making. Strengthening information systems for health and digital strategies to facilitate monitoring of progress towards national, regional, and international agreements and indicators, identifying and managing conflict of interest, and reducing inequities, all towards the progressive realization of this right. Again, this issue of rights, this right to health. And we have a number of strategies, and you'll again see this, these themes that keep raising themselves, keep being reinforced. Advocacy and communication that reframe NCDs. What are NCDs? And really reinforcing what this group of chronic diseases are. Greater engagement of people living with NCDs to amplify their voices, centering the work that we do around the experiences of people living with NCDs in these groups to ensure that interventions are tailored to their needs and their voices are heard. Enhanced investment in and capacity building of civil society so that we as an entity are fit for purpose to do the work that we know we must do, whether this is advocacy, whether this is service delivery, ensuring that we can contribute meaningfully. Raising awareness, sharing information, and building capacity through an involved and informed public. Creating that informed public through engagement with traditional and new media on a variety of platforms, including digital platforms. Using settings, really leveraging schools, workplaces, health centers. How do we use those settings to reach populations? Integrating multi-sectoral actions that address NCD reduction and related issues. Partnerships again, research, surveillance and monitoring. Identification and implementation of sustainability mechanisms. In our resource limited settings, sustainability is so critical. And promoting the development of plans to implement the Transformative New Agenda. And so, against the background of this new agenda, what are some actions that we are asking different sectors to undertake? And for government, developing and enacting legislation. Again, we have the WHO best buys and recommended interventions. We know what works. Developing and enforcing regulations, formulating policy and safeguarding policy-making spaces from industry interference. And very much linked to that, identifying and managing conflict of interest, especially when establishing effective mechanisms for multi-sectoral collaboration, collaborating across whole of society and whole of government, using the settings approach, and ensuring, again, progressive realization of human rights, including this right to health. And civil society, what can we do? We need to advocate at all levels, the policy level, technical level, grassroots, pushing for social inclusion and creating activism, really fostering that sense of activism amongst our constituents and amongst our organizations, playing our role in disseminating information, participating in policy development and protecting policy-making spaces. And increasingly, we're seeing these examples of engagement of civil society at the highest levels in policy design and policy evaluation. Playing our role as a watchdog in identifying and managing conflicts of interest. And these are not only conflicts of interest at the level of policymakers in the public sector, but also within our own work, conflicts of interest as civil society organizations. Performing that accountability role and developing systems that are simple and easy for civil society to use in order to play this role. Mapping and countering interference of the unhealthy commodity industry in public health policy. And building public awareness about the type of interference that we're seeing. Giving a voice to the voiceless, again, this idea of engaging and empowering and using various platforms to do this. Capacity building, contributing to research, contributing to promoting policies which really tackle various settings, and justifying and lobbying investment in and involvement of civil society, including in interventions for capacity development and strategic partnerships. And what about the role of the private sector? Innovating and conducting and research and development, reformulating products to provide healthy options, contributing to workplace health and reduction of absenteeism and presenteeism, corporate responsibility, and using corporate responsibility for good rather than promoting products which we know contribute to ill health, contributing into and implementing a social business impact model that demonstrates shared value and win-win options for business and public health. How can private sector generate profits through the production of healthy commodities rather than unhealthy commodities? And refraining from policy interference and complying with conflict of interest policies and management. And what of our development agencies? Providing technical, financial, human, and other resources, facilitating resource mobilization, sharing evidence-based knowledge and information, including good practices, developing norms and standards. And I want to, as a civil society actor, I want to emphasize this idea of providing resources for projects and programs, and congratulate CARFA and PAHO, who have worked closely with civil society over the past few years, whether it's through signing of MOUs or signing of letters of agreement, to really meaningfully and tangibly contribute to the civil society's response to NCDs. And so as HCC seeks to deliver on the transformative new agenda that we are proposing and launching here today, we have a number of key actions which will be outlined and detailed in a 2-year action plan. And they include, and I've listed some here, and they're by no means exhaustive, but it is our contribution to playing a small role in changing the landscape of NCD prevention and control in the Caribbean towards one which is underscored by a rights and equity approach. And with those quick words, I'm conscious of time. I'm going to hand back over to Sir Trevor to introduce the next section.
So thanks very much, Maisha, for that excellent, very, very comprehensive overview of the Transformative New Agenda. There's much work to be done. At this point, I now invite Sir George Allen, Director Emeritus of PAHO and patron of the HCC, to chair a panel discussion on the perspectives on the Transformative New NCD agenda. Sir George.
Thank you very much, Sir Trevor. It is interesting that the moderator never gets a chance to introduce himself. I assume everyone knows that Sir Trevor is the president of a distinguished cardiologist, is the president of the and godfather and chief mover of the Healthy Caribbean Coalition, and a great advocate for civil society, not only in the Caribbean, but globally. So thank you very much, Sir Trevor, and thank you very much, Maisha, for that masterful presentation of the content of the new transformative agenda. By definition, an agenda is a list of items to be addressed. And what Maisha has done is not only outline the list of items to be addressed, but she's gone beyond that and articulated quite clearly some of the instruments for addressing these particular items. And what she's pointed out, I don't want to go over Maisha's presentation, what she's pointed out is the rationale for there being a new agenda. That's the aspect of new agenda. What is new? And she points out that what is new is the presence of COVID. COVID has caused us to think anew of the things to be done to address the problem of the NCDs. And if I may marry her comments to those that have been made by Sir Trevor, in a sense, the Caribbean has not done as well as it might have done, as it should have done in terms of prevention and control of NCDs. And now we put COVID on top of that. There's even more urgency for looking at what has been done and what needs to be done to address the problem of NCDs. So if you take the rationale of the agenda, that list of things to be done and things by which they might be achieved, if you take those two things together, then we have the, in a sense, the rationale for this for this panel. If we're going to address the agenda, if we're going to look at the instruments necessary to address the agenda, then I would contend that there are a couple of things that are absolutely necessary. One, has been pointed out, involve the people who are intimately affected by the problem. And secondly, we need to have some method of making this agenda operational, some instruments for making this agenda operational. And one of the key instruments for making this agenda operational are really institutions. You cannot really achieve anything in a society as diverse as ours without involving key institutions in making these things happen. So I would submit that is the direct attention to the people and direct attention to the institutions within the Caribbean and that have affinity to the Caribbean. It is by that way we will have progress in this transformation of the situation in the Caribbean through the agenda. And that is the rationale for this panel. This panel represents a conglomeration of distinguished persons who in one way or another represent these key institutions and also represent the people that are affected by NCDs. We have as speakers, Ms. Tara. I'm going to introduce them all at once rather than do each one individually. We have Ms. Tara Lisa Prasad, who is the technical advisor from HEC from Our Views, Our Voices, and she's an immediate past member of the NCD Alliance. Dr. Anselm Hennis, the director of non-communicable diseases and mental health in the Pan American Health Organization. Mrs. Nicole Foster, a distinguished lawyer who is deputy dean of academic and student affairs, and she's also from the Faculty of Law and an expert in trade policy. We have Dr. Joyce St. John, the eminent executive director of the Caribbean Public Health Agency, to which Maisha referred earlier. Dr. Karen Seeley, who is the founder of Trinidad and Tobago NCD Alliance and also an NCD board member. Mr. Pierre Cook Jr., he represents an important group of persons important for this transformation, the Youth Voices Technical Advisor. And then we have the Honorable Christopher Tufton, the Minister of Health and Wellness of Jamaica. So without further ado, I'm going to begin with Ms. Prasad. Ms. Prasad, given your experience, how do we encourage governments to have the views and voices of people living with NCDs reflected in their NCD program? How do we do that? How do we encourage governments to do that?
Thank you very much, Sir George. As you said, I come from two lenses. I come from a development practitioner lens, as well as a person living with NCDs, because I've been in palliative care for cancer since 2014, but I've also been a policymaker at the national, regional, and international levels, spaces in the Caribbean. And I would say, Maisha, as well as yourself, touched on that way to make sure that this is not only transformative, but that policy is driven by a people-centered approach. And you look at policy being crafted by institutions, and then you look at people being at the center of the policy making. And that's, for me, the only way that this TNA will really be transformative, is if people are put at the center of the policy making. And as policy makers, we are not taught that. I mean, in the 21 years that I've been doing policy development work, we're not taught or encouraged to listen to people, to the people that we are making the policies or drafting the policies for. And I think that that is the only way. Maisha talked about integrating the people into the policy cycle, and it has to be the whole policy cycle. So it has to be research on the policy creation, policy development, it has to be policy implementation, and it has to be when we're looking through the the lens of, is this policy working? So the monitoring and evaluation of the policy. And we're really not taught as policymakers to do that. I mean, I participated in the development of the political policy agenda for the 5th Summit of the Americas and for the Commonwealth Heads of Government meeting in 2009 when Trinidad and Tobago hosted it. And I can tell you, we had an NCDs, the CHOGM had an NCDs agenda, an NCD statement come out, and NCDs were also included in the declaration for the Commonwealth Heads of Government, as well as the 5th Summit of the Americas. We had on the sidelines civil society meetings, private sector meetings, but their views were not incorporated into the actual policy political documents. And that's because those are negotiated by politicians and by governments well in advance of those meetings. So those meetings are lovely to have, but the voices of those people are not heard in these political documents. And that, to me, has to really shift and change. And it's not easy for policymakers because they're pulled in lots of different directions by leaders, by the politics, by civil society, by private sector, by a lot of different actors. And a lot of it, I think, requires a lot of the efforts that Maisha had touched on in the presentation, among others, partnership, consultation, patience with each other, respect, negotiation, consensus building, capacity building for policymakers, because policymakers are not always so sure of what's supposed to go into a policy. And then policy implementation and involvement of people in policy implementation is key. I can tell you that for the 6 years that I have been diagnosed with what I've been diagnosed, I've been trying to participate in a civil society group. And while they're very happy to take my donations, they're not really happy to hear anything about what I say or what I have to contribute. And so we have to speak, we have to talk the walk. We have to not only do lip service, but actually really walk what we're saying in terms of transformation, or it won't happen. And if we're not including people, really, it's nothing will change.
Thank you very much, Ms. Prasad. And I like your idea of incorporating the voices of people into the forum in which policy is made, and make sure that those who make policy do have the voices of those who are going to be the beneficiaries or objects of that policy. That's absolutely critical. Now we turn to Dr. Hennis. Dr. Hennis?
Morning. Yes, Sir George. Good. Now I'm supposed to be talking to you a little bit about the implementation challenges that the Caribbean has been significantly off track in terms of meeting the 2025 and the SDG targets for NCDs. And it's now further complicated by COVID. What are we going to do to get governments back on track? And I'll just start off by saying very briefly that the whole idea of NCDs being a global crisis was started and birthed in the Caribbean, and I'm sure you're one of the godfathers of that effort, Sir George. And in spite of that, a decade ago, the Caribbean still is a sub-region of the Americas with the worst outcomes with NCDs. We have the highest rates of premature mortality. And this is actually going to be worsened because of the COVID epidemic. Now, we've done a lot of work in terms of technical guidance, in terms of highlighting the increased risks, how to maintain essential services, etc. But and also in terms of the disruptive supply chains, the fact that the Power Strategic Fund has capacity to aid countries. But what do we need to do? We need to invest in health. Had the investments we made initially, the disruptions, we were not seeing disruptions that exist. And in fact, there's a book which sometimes we've spoken about by Stuckel and Basu, which speaks to the fact that the body economic, why austerity kills. And in fact, in difficult times, we need to invest more in social protection and in health and education services. Now, we need to strengthen NCD care at primary health care level. That is critical. That's the basis of a functioning health system. And I use the example very briefly of hypertension. It's the biggest cause of death that's treatable in the world. And but despite treatments for hypertension being safe, effective, and low cost, very few people in the world have their hypertension control. And this is also an example in the Caribbean. And there are standardized protocols that will make a difference to hypertension control. And they're actually piloted successfully in Barbados a number of years ago. These have not been implemented. And in fact, Hearts in the Americas is one such mechanism to improve the quality of NCD care in the primary health care services. We also have to look at keeping the innovations out of work during the time of the pandemic. There's no reason to revert to overcrowded outpatient clinics. Let's build and digital technology that worked for us during the time of the pandemic. Risk factors. The Caribbean has the highest rates of obese children and adolescents. And of course, if people were informed through front of package warning labels, I'm not going to dwell too much on this, this allowed them to make informed choices, and they have the right to know. These are things that the Caribbean must go advance and requires government, civil society, and private sector engagement. Similarly, tobacco. Heads of government and state said they'd have the Caribbean as being a smoke-free region by 2022. We have made very, very little progress. These are things that we must take forward. Briefly, in terms of the mental health crisis in which we're sitting now, for the very first time, there's been a WHO response to this global pandemic of mental health situations due to the pandemic. And we have to basically invest in mental health systems. They only take about 2% of the health budget. So we have to find a way to support children. We have to find a way now to encourage governments in terms of their role to have a whole of society approach to promote, protect, and care for mental health, ensure the availability of mental health and psychosocial support, and support recovery from mental health. So I think my time's up. I need to stop there. Thank you, Sir George.
Thank you very much, Dr. Hennis. Well, my next panelist is Dr. Foster. But one of the things that has come up over and over and over again when we speak of people, policymakers, is it has been noted in the chat, I want to emphasize it here, that so many of the policymakers have one of the NCDs. And I was saying to Maisha, I don't wish you to answer the question now, but I would guarantee that every one of the panelists here today suffers from one or either of the NCDs. I'm sure we're all among that group of persons affected. Now, how do we achieve this human rights and equity? How do we craft this lens to which Maisha referred? How do we craft this human rights and equity lens in addressing the issue of NCDs? And I'm going to ask Nicole Foster to address this issue. How do we craft that lens? And how do we shine the light through that lens?
Yes, thanks, Sir George. As you correctly said, and as everyone is saying, you know, human rights, a human rights-based approach is really key to making progress in this area. And essentially, when we talk about a human rights-based approach, there's certain key principles that we have to integrate. So principles of accountability, transparency, equity, people-centeredness. And it is really a question, where do we start? We start at the policy level, as has been said, in the sense that we recognize that in crafting our policies, it is important to ensure that those policies are developed in the most informed, inclusive, and detailed way in terms of the stakeholders that are involved. And from the very beginning, as Lisa was saying, from the very beginning to the end. So don't just talk to them at the beginning and then, you know, as we're going through or as we're implementing, not continue to take on board the feedback. But I think really what all of this points to is a challenge from a governance perspective. So we really, because as you were saying, Sir George, you know, institutions are key in this process. And so we're not going to magically, you know, we can say all the time a rights-based approach and talk about the principles, but really what that entails is changing the way in which we govern and changing our governance systems and structures within institutions where we build in these ideas and principles. As Lisa was saying, policymakers are not necessarily accustomed to having to formally think about these things and these ideas and include these persons. And therefore we have to ensure that our governance systems, our structures that we have in place, build those things in so that we can ensure that we get the outcomes that we want. And I think in this regard, that civil society, for me, where I would start is with civil society, in the sense of, certainly within the Caribbean, human rights and the whole idea of human rights-based approaches is something relatively new in terms of integrating human rights into everything that we do. And I think that civil society and players like Healthy Caribbean Coalition have a very important role to play in terms of empowering the community to better understand these rights so that they know what to demand of their governments and they know what to hold their governments to account in return. respect of. And so that's really where I would start with civil society in terms of helping them to build that capacity within the communities to sensitize persons about rights, about the procedures and institutions that are there that allow us to enjoy those rights, and to hold governments to account in that regard. And then the next step is to then put the pressure on governments to ensure that our governance structures integrate these principles.
Thank you very much, Nicole. You are stressing very much that civil society is one of the institutions of the state, has a fundamental responsibility to ensure that governments, which are the agents of the people, are accountable to the people. And one of the things for which they should be accountable is the consideration of the equity and human rights approach to dealing with persons living with NCDs. This puts a major responsibility on civil society, which I'm sure HEC has been careful to hear and to aware. Our next presenter is Dr. Joyce St. John. Dr. Joyce St. John, we spoke of the transformative agenda, and we spoke of the context of COVID. You have been very much involved in the Caribbean's response to COVID. What are the lessons you have learned from your response, from your involvement in response to COVID, that are applicable to the instrumentation of this new transformative agenda?
Thank you so much, Sir George, for that opportunity. We learned through research conducted in the Caribbean that persons with NCDs did not feel comfortable or were not able to access the regular health services. We also learned that those who were able to access the health services were able to benefit from some really innovative ways that the health services created to ensure that there still was some level of control exhibited. And I think specifically of the pharmacy services. We heard of some innovative ways in which the pharmacy services in the public and private sector assured that people still got their medications. We also learned that NCDs in the Caribbean, like in other jurisdictions, did predispose to more severe and critical disease. And it also predisposed to younger persons developing severe and critical disease and dying. One of the other things that we found out was that because the Caribbean has small health systems, a lot of the resources from the NCD program were used to buttress the COVID-19 approach and response. So we realized that there needs to be a lot of support of the NCD program, not just from the perspective of surveillance to ensure that we get our numbers on the persons who have NCDs who also have COVID-19. But we need to support our focal points to ensure that they have the tools and that they are networked so that they can support each other. One of the things that we are hoping to do is to ensure that we have a new network of NCD focal points, that we have an integration of the surveillance of non-communicable diseases into our understanding of what is happening with COVID-19. And we're trying to support, along with PAHO and other players, our ministries of health in ensuring that certain basic services are still available and accessible to persons living with NCDs.
Thank you very much, Dr. St. John. You've given us a menu of things that can be done, things that you know from lived experience are perfectly feasible. Thanks very much indeed. Our next presenter is Dr. Karen Seeley, who is, she's, as I mentioned before, the founder of the Trinidad and Tobago Previous Alliance in this incarnation. But she also has a lot of experience in governments. So my question to Dr. Seeley, what steps you think civil society can take to support governments to making them more accountable? Because governments need not only to be castigated for not being accountable, but they need to be supported to be more accountable. Dr. Seeley, do you have any thoughts about this? You're muted. You're muted.
Yeah, sorry. My apologies. Thank you very much, Sir George. A question on which I've pondered for often and for a long time. Yes, I think we really have as civil society a very key role in keeping governments accountable for their decision making, I would say for their commitments. And so therefore the first query would be, does civil society know what the commitments of the governments are? All countries have national plans. Does civil society understand those plans? Governments make commitments at the CARICOM level, at PAHO level, and at the UN level. Does the civil society know when that is taking place and what they are? And so therefore there is a need to help civil society to understand what the commitments are at the various levels. Knowing that, then it would be easier for them to be able to supportive in the holding governments accountable. It's interesting that in many of the outcome documents at the UN, they call on the governments to set up the accountability mechanism. And here is when one of the ways in which, or one of the opportunities that the civil society has for promotion of that whole of society approach, because governments have to be accountable to someone, to society, and that society should be involved in the accountability mechanism, in the design and also in the implementation of it. And so to do this, it is important for civil society to know what are the available tools and opportunities that we have right now for monitoring. There are the WHO monitors at the global level. CARICOM and its regional institutions monitor at the Caribbean international level. And of course, PAHO does that as well. And perhaps what you might find is we know more about those than we know what's actually happening in terms of monitoring at the national level. And civil society has to insist that they be aware of what is happening, and that in government report, I want to use report back to its citizenry on those commitments they've held, that they have made. I will also note that often civil society does not know when these commitments are being made. And so it might be an opportunity for HCC to establish a calendar of what I will see as policy related events at the international and regional level, so that civil societies in the countries can know that they have to advocate with their governments before those meetings in order to be able to get the commitment and to find out what it is the state of affairs for the governments. And finally, I would say, just like many people have said before, there's an important role for civil society for which we need to build capacity. We need to build capacity for advocacy, someone said before. We need to build capacity for this monitoring and evaluating and assessing for accountability. And I want to remind persons that in the first political declaration of the 2011 high-level meeting, governments called on the international organizations, international NGOs, to build the capacity of national NGOs in all areas. And this is one perhaps where we can urge international organizations to assist civil society in countries for this purpose. Thank you.
Thank you very much, Dr. Seeley. That is an interesting note on which you ended. And I refer back to Maisha's comment about the MOUs she has signed, HCC has signed with PAHO and CARFA as being an example of what you're advocating. And I take your point that that should go wider. It should be broader and wider and much more, and also that it be monitored appropriately. Our next speaker is Mr. Pierre Cook. Mr. Pierre Cook speaks from the point of view of the HCC Youth Voices Technical Advisor. And we all speak about young people being involved. We all were young once. We all would think that there is a role for the youth. But how do you think young people should focus their efforts? There's so much that we ask young people to do. But in this occasion, how do you think we should focus young people should focus their efforts in addressing the aspect of NCDs which of course is critical for their own future. How do you think they should focus their efforts, Mr. Cook?
Thank you, Sir George, for that introduction. I think necessarily what has always been something that I've recognized is young persons are most active in the advocacy space and in sharing messages and in raising awareness on issues, particularly with the NCD issue that we're addressing. I think having young persons who their capacity are built by civil society organizations, they're supported in terms of their messaging, they're supported in terms of how they carry out this action. Having them within that space can be most effective for civil society organizations. What that calls for then is for meaningful youth engagement to ensure comprehensive use of this transformative new agenda and to revolutionize the way that advocacy works within the NCD space. We need to ensure that within our civil society organizations or private sector or even the government, there are formal structures in place so that youth can be consulted continually in the NCD response, or even during the COVID response, we saw that there was a lack of the consultation with young people. And the follow-up of that, or what we saw, is that the needs and issues that young people were facing were not adequately addressed. I used the example recently when I was speaking to some 13-year-olds of, you go to the doctor and you're there and you have an issue, you have a headache, but he treats your foot, he bandages your foot, he makes sure that your foot is well. But that's not where the issue is. And the only reason he treated that is because he didn't consult you, there was no conversation, there were no questions. So necessarily, if youth are to be impactful and to be most effective within the NCD space, our capacity needs to be built in terms of sharing these messages, understanding what the issues are, using the science and being able to share with others what the issue are and from the youth perspective, so that our needs, our rights are adequately and comprehensively addressed.
Thank you very much. That's a very succinct menu for the youth. Very well done. Thank you very much indeed. And now, we have with us now Mr. Tufton. Now, Minister, you have championed policies and legislation in relation to this event for a couple of years. More recently, I have been very impressed with your championing of the aspect of the front of package labeling, of which I think many of us are very hopeful that this will advance to the stage where we get a definitive decision. You've also had to face many challenges to how to implement these NCD policies and legislation in the Caribbean. What are you must have developed some strategies for overcoming these challenges. What are some of the strategies you have developed to overcome these challenges, Minister?
Thank you, Mr. Chairman, and good afternoon or good morning to all colleagues and those who are online. You're right, there have been real challenges as it relates to tackling the NCD epidemic, and this most recent global pandemic, COVID-19, has created even additional challenges from the standpoint that the attention has been shifted to dealing with COVID. But what is interesting about that shift is that if you do the analysis, you'll recognize how challenging NCDs are, in that the most vulnerable, and indeed most of the victims of COVID have been persons suffering from comorbidities, 1 or 2 NCDs. So it brings into sharp focus the need to carry the NCD agenda, and this is a message that we have addressed here in Jamaica. I have certainly spoken to it. Our policies, Mr. Chairman, lies in a 10-year strategic plan, which was developed, that has policy components, but also infrastructure components to that plan. So when I became minister 5 years ago, I wanted a roadmap, and I think all of us need a roadmap because it requires agitation, or it requires lobbying, it requires pushing the agenda. We need to be clear. Of course, that is grounded in data, and the Jamaica Health and Lifestyle Survey tells us about the high prevalence of hypertension and diabetes and other forms of NCDs. So we use that to create a messaging that connects with persons who are suffering from those ailments. There are 3 components: prevention, treatment and care, and infrastructure development. And added to that, very importantly, is partnerships, multi-sectoral approach that is very important to driving the policies and programs. These are the ones that we have identified as being very important here. The tobacco legislation. I have now tabled comprehensive tobacco legislation, about to appoint a joint select committee on Tuesday, where we will invite comments, but Jamaica will see, hopefully, a debate in the Parliament in the months to come for a significant overhauling of tobacco control. There's also the green paper that we're about to go to cabinet with on alcohol. So alcohol policy or alcohol abuse policy, and we're adding the final touches to that. Then there is a number of studies that have been commissioned to create baseline information that policy will be driven from around sodium and its usage, sugar and its usage, and trans fats. We have most advanced in trans fats. We're now testing our foods using our labs here to see what the prevalence of trans fat is. Of course, we are against the use of trans fats, and the baseline studies are intended to drive that agenda. And then there's the NCD task force to support consultation and collaboration. And that task force or commission is being set up so that we have the multi-stakeholder approach. The front of package labeling, which you mentioned earlier, is a big area, and we're driving that also through our various task force to ensure that we liaise with the critical stakeholder bodies here in Jamaica, but also in the region, and we're committed to driving that program. And finally, the greater emphasis on the implementation of a breastfeeding policy as a means of prevention for childhood obesity and establishing good nutritional base for children. And that is being accompanied by a policy to soon to be tabled around our nutrition in schools. So what is it that the canteens prepare? As you know, last year we drove, and the year before we drove, sugary drink restrictions to our younger population. We're now widening that with a nutrition policy for our younger population. Chair, I will stop there. I mean, there are challenges are associated with each of these. We have to lobby, we have to push, we have to collaborate. And of course, there's always going to be pushback from various groups, but we believe that the message is strong, and that once we get to the population with a good communication strategy, the lifestyle is really what it's about for us. I've always said that it's not just about a clinical diagnosis or clinical prescription. Lifestyle is not on a prescription pad. It's really about getting persons to change their approach. And that's why the Jamaica Moves program, which has morphed into a Caribbean Moves initiative, for us has been very important. How do we train persons to know their diet, take exercise, and know their health status? Thank you, Chair.
Thank you very much, Mr. Minister. I must confess that my heart warmed when you mentioned the three things: lobbying, pushing, and collaborating with various entities, and having a strong message, and a strong message so that there would be a commitment to a policy at a community level. I'm going to start the questions on that note of policy, because this has been mentioned over and over again. So first of all, thank all the speakers, not only for their presentations, but sticking to time. Several people have mentioned policies, and policies have to come before implementation. But you mentioned policies as if there's something that is already there. So my question to you is, how does one go about creating the policies that are necessary to drive this implementation agenda? Policies have to come from different places. I'm going to begin at random with Dr. Seeley, for example. How do you think these policies have to be created? What is the mechanism for creating these policies?
Well, government is responsible for creating these policies, and government's policies usually start from determining what the status in the society around a particular problem is, and determining where we want to go. It is in determining the status and in determining the strategies. Those are the stages we need to not primarily, but initially involve the PLW, the persons living with or affected with NCDs.
Okay.
So the government needs to, the civil society needs to know the intention of developing a policy. The door needs to be opened for civil society to be able to engage with formally and informally in the process.
Thanks very much. Dr. St. John, you also been very much involved in the policy space, both in your previous life and in this current life.
I still have one life in the continuum. One
Very
thing
good.
that I have found is the importance of evidence, and for Caribbean people, the importance of Caribbean evidence. And so research and the fostering of research, not just the usual heavily technical, but also why did something fail or why did something happen? So the operational research, and in that regard, the annual health research conference, which was supposed to be in Jamaica last year, but unfortunately COVID thwarted us, is extremely important. And the fostering of research among persons living with NCDs is one of the ways. But apart from the research and the evidence, we need to also show our Caribbean people the way in which to move from point A to point B. I'm not talking about breathing down their necks. I'm talking about holding their hands. So what seems insurmountable is broken down into bite-sized chunks, especially in this COVID era with limited resources.
Thanks very much. Nicole, you also mentioned the issue of policy. How does one, you said that policy making is like sausage making, isn't it? How do you actually get these policies done? And before I go on, Dr. St. John, obviously you resonate very well with the comment made by Masha about the need for research in this particular area. Mrs. Foster, let me ask your comment again about that, the mechanism for making these policies, because you speak blithely about them.
Well, as Dr. Seeley said, normally within the government system, there is an established, within the ministries, etc., you would have an established mechanism or means of, so for example, we would have in the phone speech or something like that, the government might indicate certain priorities, and based on that, the ministry works out their plan and they work out what legislation or additional policies might be needed, and then they start working on that. The challenge is that sometimes the structures that we have in place are not necessarily as all-inclusive as we would want them to be, as comprehensive to address something like NCDs that is definitely needs a whole of society, whole of government, whole of everything approach. So the challenge is, it goes back to my earlier point about that we need to look, I think the structures are there in a sense. What we need to do is to look critically at how it is we do what we do and whether those structures are sufficiently robust. And I also wanted to make a related point about, you know, in terms of research, that the point that is being made about research. And of course, you know, kind of wear my University of the West Indies hat here. Clearly, the UE plays a critical role in terms of providing that support, in terms of generating research, which speaks to the Caribbean experience. But while I always, and I fully endorse the importance of having Caribbean research, and we need to have more research and more publication, I also wouldn't want us, you know, Dr. Hennis has talked about the urgency of the situation. And we know that there is a lot of evidence out there. There is a phenomenal amount of work that has been done. And in many instances, it does not require us to reinvent the wheel, that on every single issue, we must have a Caribbean study before we can move forward. And certainly in the area of nutrition policy, etc. So I continue, as I said, once again, look critically at our structures to make sure that they are as robust as they need to be in light of a human rights-based approach. Make sure we have the evidence and research, but do not let the Caribbean perspective hold us up necessarily if the information is there.
Okay, don't be too jingoistic. Mr. Minister, we've talked a lot about policy. We talk about shaping policy and ingredients to shaping policy. From your experience in Jamaica, what are which are the agencies, the institutions that feed into your policy directives? I mean, can you give us an idea how, when you construct a policy, what are the ingredients for the construction of that policy? I know there are obviously political considerations. What are the other considerations that feed into the construction of your policies?
Well, first of all, I think policy has to be grounded in data. It has to be data driven, because even though you don't want to sort of be too academic, because you have to communicate and people have to be able to receive the information, you can't be too anecdotal. You have to provide the evidence to influence the influencers around why it is important that NCD is a problem. I mean, the basic data being 7 of every 10 Jamaicans die from an NCD. That's fairly significant. The issues around sugary drink and its impact on our young people, the data is there. So you ground that, then it is about how you communicate that information. So packaging of that information is absolutely critical, because the language and the culture has to be able to receive that information. And that's why our Jamaica Moves initiative, for example, which tapped into culture and music and colors, you know, the sort of carnival-like atmosphere of Caribbean people, which we all enjoy and we share in, to say to them, exercise half an hour a day, enjoy it while you do it, balance your diet, so make something green in your plate, the fruits, the veg, that sort of thing, and of course visit your doctor. And so the communication is important. Beyond that, civil society, I think, is absolutely critical, which is why I support HCC and its initiative, which is why I support the Heart Foundation, the Cancer Society. I meet with them, we discuss, because they have a reach that allows a collaboration that drives the agenda, and I think that's critical. And the collaboration with our regional and international institutions like CARICOM, absolutely critical. We cannot leave them out. So for me, I look at policy as in a holistic way, where you start with information, you see collaboration, and you drive that agenda. Once the people are in tune with that, the politicians have to follow.
Thanks very much. Thanks very much, Mr. Minister. You mentioned the issue of evidence, and that came up on several presentations, the whole issue, getting information to civil society, and that information being derived from existing or previous research. And it was mentioned before that there needs to be a networking of civil society to facilitate the distribution of that information. Now, Dr. Hennis, if you were to think about these networks of civil society organizations, all networks tend, as I always say, to a state of entropy. All networks tend to dissolve. What would you do? What would you suggest to keep these networks together? Because as Maisha points out, and has been said here, these networks through which information is shared are absolutely critical. How are you going to keep these networks together?
Thank you so much, Sir George. If you may indulge me for 10 seconds, Sir George, also on the issue of policy. Policy actually evolves from the countries and the ministries of health, because the whole process of the resolutions and the mandates for NCDs, which are done at the PAHO level and the WHO level, come from the ministries of health coming together, agreeing on resolutions, and process the measure indicators. I think one thing which I'll share very quickly is that quite often there's lack of coherence. So we may have a mandate in tobacco at the level of health ministries, but the Ministry of the Economy may not be aware of it. So I think the whole issue of intersectoral coherence is very important. Now, the question you posed to me about networks, I think networks work best of all when they are strong leaders who tend to inspire and drive networks. And we can see this example in the HCC, for example, which is now the driving force between what we're doing as we speak now and groups like the NCD Alliance. And there's data, for example, that where NCD Alliance has a presence in countries, there's more activity in terms of NCD responsiveness and approaches at the societal level. How to keep them engaged? And it really comes through, I think, having good communication platforms, linkages with international organizations. So for example, we have very, very strong linkages with HCC. We have very dynamic linkages with NCD Alliance. So I think building networks beyond simply the social networks themselves, but reaching out to international agencies, I think is very, very important as part of the discussion. having platforms where they can share ideas and collaborate. And I think the engagement with between the different levels, not simply just networks themselves, but with international public health agencies and academia, is also a key ingredient to success.
Thanks very much. I'm supposed to have a couple of minutes for closing remarks. I'm going to cede those 5 minutes to continuing with this very interesting discussion. And I'm going to ask Ms. Prasad. Ms. Prasad, you mentioned that many people are not prepared, many of the groups are not prepared to listen. Would that mean that there needs to be stronger linkages between these networks so to facilitate getting your message across? And if you accept that thesis, can you think of a method, a way of facilitating it?
Yes, I do. I actually think, yes, it does require much more consultation, much more partnership, but maybe we shift the paradigm. So instead of expecting policymakers to invite us, whether civil society, whether the various NGOs, whether the private sector, into their consultative space, why don't we invite them? Why don't we switch that paradigm around and invite them and make sure that when we have our meetings, they're there, they're listening, that they're not just there to open an event or to cut a ribbon or to just be there and leave at the beginning of a webinar, but to be there, as Minister Tufton is, for the entire thing, to listen to the voices of the people that are actually talking and discussing the matters at hand and crafting solutions. So flip that paradigm around and be more inclusive and invite people into your spaces, but also listen to them. Policymakers need for us to listen to them as well. So it's an exchange on all ends.
Thank you very much. Minister, you hear, you'll be given kudos for remaining through the webinar. Mr. Cook, we've talked a lot about information, we've talked a lot, but is one area in which you have advantage over all of us. Your young people are the ones that have raised dissemination of information to a higher level. Now I'm going to ask you, what would be your recommendation? What would you see the roles of the youth in facilitating the dissemination of this kind of information, facilitating the dissemination of this kind of evidence that Maisha has pointed out is so critical for the success of the transformation that has been posited?
I think I had this discussion just last year with Dr. Tedros when we had a discussion on the response to COVID and necessarily how young people were engaged. And part of it was speaking about the need for CSOs to invest in youth participation as a direct response to COVID-19. And I think we need to translate that into the NCD space. What can happen in order to have this dissemination happen more effectively among young people is to engage in more youth-initiated, where we can share the decisions with the adults in these organizations, projects and programs. So where young people are brought on board to lead projects, to lead programs that share information about NCDs, share information about obesity, so that we then can transform and create the dialogue in a way that young people can appreciate, so that the messaging is most effective to persons our age and within our age group. It takes a multi-sectoral approach. And young persons within different sectors, young persons within the legal space, so whether they're young law students or young medical students or young social science students, who can all come together to understand the information being presented to us on the impact and the crisis that we're facing with NCDs, then we can understand how we can share those messages and tailor them to the specific groups that we represent. So the law student can tailor it in a legal way, the social science student can tailor it in a social way, so that we have the most effective way to disseminate the information among youth and among persons our age.
Thank you very much. And let me add, since you didn't add it, we are masters of the social media. We are masters of the social media and social networks. So if you really want information disseminated massively, talk to us. Let me thank the panel very much for this very interesting discussion. I think I've learned a lot. I think I learned a lot about the critical nature of evidence, the critical nature of information, the critical nature of policies, and the critical nature of networking among the various parts of civil society. So thank you all very much. And now let me hand over again to Sir Trevor.
Thanks very much, Sir George and panelists, for this really, truly very rich discussion. Many thoughts and ideas have been advanced, which will be added to our considerations as we look to implement this transformative new agenda. An agenda, in fact, which when one reads it and gets into it in some detail, will be appreciated that it's an agenda that requires all hands on deck. At this juncture in the webinar, I'd now like to invite Dr. James Hospitalis, who's founder of Earth Medic, Earth Nurse, and a special HCC advisor, to facilitate an open Q&A session. There have been many questions posed, many comments in the chat box. I encourage all attendees to engage significantly with Dr. Hospitalis in this next session. Dr. Hospitalis.
Thank you, Sir Trevor, Sir George, Maisha, Joy, other colleagues. I'm really happy to be here in this webinar. We've had a lot of good food for thought from the excellent presenters on the need for a transformative agenda for NCDs. And I'm struck that everyone who has spoken is a committed public health leader or practitioner or institution that's been laboring in the vineyard. The number one shout out message to me at this age and stage of my life is that governments and businesses really are not getting the job done. And there is a critical need for civil society action, citizen-led, consent-based systems. In Trinidad, they say you need to get on radical if you wish to be heard. We need to use a lot more the political and consumer power of people who live with NCDs. But my job is to moderate a 15-minute discussion and the questions from the chat and the questions you may wish to ask. I've been asked before opening the floor to make a brief comment on strengthening regional partnerships and leveraging synergies across priority issues such as climate change. And that's because the Transformative National Agenda has 5 priority focus areas, including partnerships and networks, and a key strategy to integrate into other multi-sectoral actions that are related, such as the climate crisis. In this comment, I'm just highlighting 3 areas for synergy: climate change, economy and finance, and digital health as an integrator. Climate change and the economy issues are standing agenda items at the Conference of Heads before COVID, but we know COVID is very much connected to climate and to the fact that we have an NCD epidemic. And the digital approaches have accelerated since COVID and really can support the aspirations of our single market and economy, where Prime Minister Mia Mottley is the lead head. So synergy with climate change, I wrote a piece with Prime Minister Harris for the G7, G20 on climate and NCDs as being 2 sides of the same coin. Why is that? And if you think about it, do you realize that 2 of the major climate drivers are mechanized fossil fuel agriculture and motorized transport? These are the same drivers of our poor diets, obesity, sedentariness, and air pollution, and so on. And this is going to become more and more the context for action. Just think about last year, beside the spectacle of the US politics. We broke heat and carbon dioxide records, apocalyptic wildfires, the hurricane season down to Eta and Iota, floods in China, biodiversity loss, pandemics, population displacement, and COVID. The many nations are waking up and setting targets and are making investments in climate action. How can we get aligned to that? And how can health and NCDs leverage this wave of interest and investment by proposing specific climate actions that have benefit to health and NCDs? This is the increasing drumbeat among young people, climate and environment, not NCDs. That's disease and death, that's down the line. But if climate action is good for NCDs, shouldn't we align or reframe our NCD medical model? If climate action equals government policy promoting and supporting local plant-based diets and alternative transport, which is also good for tourism, tying in Caribbean moves, support it with financial incentives and nudges, shouldn't we get behind that? The second is finance. I've argued in concept notes before, there's a need for a deep dive into the economic dimensions, the costs, who bears them, the investment needs, opportunities, and fiscal space. Governments have mostly signed on to UHC. but NCDs are the elephant in the room. There's a lot of evidence for this. IMF, UEL, Health Economics, CARFA, PAHO. We keep saying this is not sustainable, but there's never really been the forum to pull together health and finance, social security, the insurers, and look at a shared economy model, link it to quality and coverage and who's paying and so on. And third is synergy in the digital health partnerships. If we want people empowered and mobilized to stand up, which is what I heard Maisha call for, or rather the TNA, the Transformative National Agenda calls for, if we want people empowered and mobilized to stand up, then digital health partnerships can greatly enable this across the Caribbean. And we got a glimpse of that some years ago with the Get the Message campaign. We're working as EarthMedic with TM Forum, WHO Digital Health, and others on this. Has to be citizen-led. I'll close off in this one then. 3 noteworthy points on the digital health synergies is much less conflict of interest than on working with food or pharma, but you have significant risk around privacy and sharing trusted data issues to solve. Really, only a digital health approach promises the scale and speed of action that's needed on climate and NCDs. And it allows for a shared economy approach that can engage our Caribbean diaspora, because we move back and forth. So you're a patient in Florida one day, but the next day you're back in Jamaica or Trinidad and so on. Digital health is more than an app. Jeffrey Sachs recently outlined 6 points for how this needs to be built. And that then is my third suggestion for synergy in how we advance the Transformative National Agenda for NCDs in the Caribbean. It links to CARICOM single market and economy aspirations. It links to our ICT policy frameworks. I'll close that statement and open up for questions and answers. I am going to look at a sheet I have that summarizes some of those. And I really would like to go back to this question, one of the first ones from Elisa Prieto. But how do we empower people living with NCDs and citizens to be more vocal? How do we get people to stand up and speak? So who in the panel wants to take that one?
I'll say something very quickly, Dr. Hospitalis. I think a part of the lack of persons standing up and speaking, as I said earlier, relates to not understanding their rights, not understanding the commitments that governments have made and the obligations that our governments owe them. And I think, therefore, that a critical part of helping persons to stand up and demand more and better of their governments is to educate them about what they should expect of their governments. Also, too, I just think more broadly, and this is maybe where the sort of more social science side of things comes in, and I am not a social scientist, is that I just think culturally, you know, we're sort of going through a little bit of a change in our societies right now, but traditionally we haven't been accustomed to being engaged in governance as individuals. We've not been encouraged to feel traditionally, you know, you sort of tick for the 5 years and you give them the check and they, you know, they're the government, they do their stuff and you kind of have your say 5 years time. So I think there's also a bit of a social change that has, and is starting to take place in terms of people better understanding that they do have a role to play even during the process. But I think a big part of it is lack of understanding and appreciation of their rights and of the obligations that governments have to them. Over.
James, if I may interject here, I totally support what Nicole said. And I think even at a very basic level, the knowledge of what is out there regarding NCDs is not even known within many government circles. So for example, ministries of health sign on to a number of mandates. For example, there's a mandate in the region to reduce childhood and adolescent obesity. And this was agreed by all the ministers of health back about 2014. Now, even within governments, that is not widely known. Even within health departments, that is not widely known. And of course, CARFA has a 6-point policy on tackling obesity. So I think those of us in the space who have worked on developing these plans and policies and resolutions know about it. And the technocrats in government ministries know about it, at least in some government ministries know about it, but the knowledge is not widespread or known by John public. So I think even then, the lack of knowledge and the lack of people's right to know, in fact, the whole human rights issues, again, are not well disseminated at the population level. So we have a gap in communication. So I think that's one big issue. And secondly, getting people to stand up. You're not going to get a single person to stand up. but you can get people with the support of others to stand up. So I think it's an even broader issue if you're going to make a move in the right direction.
If I can make a comment,
reflections. Anyone else? Karen?
Yes, I think one of the things that I have observed is that perhaps we can take a lesson from what we talk about being primary healthcare based and convert that to community based, that we need to, as civil society, especially those of us who are in the technical sector as well as part of civil society, really bring these issues down to community groups. So, and deal and have dialogue with non-traditional community groups. So we talk about working with if you have housewives associations in the countries, if there are national PTAs in the countries, but not at the national level now. We need to really drill down so that if the movement is to bubble up, we have to fire the bottom. So we have to find groups that are working on the ground. There are many community development groups, women's groups that are working very much at the community level. Let's form partnerships with them, sensitize them, inform them, educate them, and use those partnerships to excite the community about the fact that this is our problem and we are going to demand a solution.
If I can just add quickly, I think that's a very important point in terms of reaching out to the grassroots organizations and community leaders and sharing our information. One of the points that we highlighted today several times is the dissemination of information about NCDs and the advocacy about it. And in getting those messages to persons living with NCDs outside of our space, outside of the civil society, outside of government, within the local communities, we have to be able to translate that message in a way that they can appreciate. And we have to go out there and reach out to them. One of the things that I wanted to highlight earlier is the importance of looking at research on the implementation of policy. So if we look at the research and the implementation of policy in different areas in the Caribbean or around the world, we see what worked and what did not work. And I think necessarily we would understand that in empowering persons living with NCDs to share the messages, to stand up, to be more vocal, you have to give them the agency and provide the space for them to speak up. If young persons or persons living with NCDs are only captured within a certain area, they're in their communities or in their villages, and we're not giving them the platform to speak and speak on, then they won't necessarily be able to share their messages. So along with capacity building, we have to provide the platforms for persons living with NCDs to advocate on their behalf and advocate for their rights, understanding the information and understanding the situation and providing the platforms for them to necessarily speak up.
Thanks for that. So moving along then, this is going to probably be a constant issue. How do you build civil society capacity, whether it's diet, whether it's physical activity, access to medicines, and so on? How do you put the several things that we've seen go on with COVID together is a question from Kenneth Canal. I think, how do you ride some of the lessons we've learned from that to leverage NCD work?
Can I get a start with that? Based on some of the information that I heard coming from pharmacists from across the region in a webinar on how the governments have re-engineered these services to ensure that persons with NCDs are still covered at least with medication. I think there is a lot of innovation that needs to be worked into regular programming. With technology, we found in CARFA that we're able to reach some countries that we never would have got to before through usual face-to-face meetings. And in having to truncate our messages into more condensed, palatable messages for the virtual medium, without killing people with too long a session, it's also allowed us to learn to be more efficient and effective with our messaging. And this is also the case with the infographics that we are using for a lot of our guidelines. So I think we need to integrate this different way of working into our usual programming.
If I could add, I think one of the areas that's necessarily been brought up during COVID, we have seen that governments now recognize, especially in the Caribbean, the importance and the vulnerable state our people were in terms of NCDs. So we know that persons who have NCDs or persons living with NCDs were more adversely affected by COVID-19. And it created a conversation nationally about what needed to be done to protect these people, what governments needed to do to protect these people, to put policies in place, to try to structure systems that ensure their rights are protected. I think what we can use during this time is the particular or the importance of this political window that we have. The time that we have where governments are engaging in conversations about NCDs, they're engaging in discussion about what they can do or what they should do. And while they're necessarily signaling the importance of it, we as civil society organizations need to hone in on that signaling and actually pressure them or push them to say, you know what, moving beyond COVID-19 and moving beyond the pandemic, what will necessarily be done to institutionalize the protection of persons living with NCDs and recognize their vulnerabilities to major pandemics like we've just experienced, so that going forward, we consistently have a system in place that is already there, it's already set. So something else comes along, we already know that we have something in place to protect these persons. And beyond that, we can modify it, we can adapt it, but there will necessarily be something in place already for the protection of persons living with NCDs.
If I can build on what Pierre has just said, James, I think we really ought to recognize and commend the Caribbean governments for their responsiveness in terms of keeping the population up to date as to what was happening with respect to COVID. Daily briefings and then weekly briefings. Constantly we were advised, something very much appreciated. Can we urge Caribbean governments to do the same on what is happening with NCDs? Can we possibly use the opportunity of Caribbean Wellness Week as a very specific time in which governments will not only celebrate what they're doing, but account for where we are in the journey towards improving the prevention and control of NCDs? I think we need to use these specific, take the strengths that we've seen in COVID and in fact, develop a strategy linked to a very specific action. And in terms of what I spoke about accountability, I'm looking for an opportunity that will, in fact, happens in all countries in the Caribbean. Caribbean Wellness Week, Caribbean Wellness Day, let's celebrate, but also let's be accountable as to what is happening with respect to the plans and in the national response.
If I can pick up on something else that was in Dr. Connell's observations, that there's been a lot of good mass public health communication around the COVID pandemic, and a lot of private sector engagement. A lot of private sector have also lost jobs or folded. But how do we, in the NCD epidemic response, a transformative agenda, integrate some of that approach?
One of the things highlighted in the one of the comments someone made in the question box is the importance of the multi-sectoral collaboration that we saw during COVID. So during COVID-19 and during the shutdown period, we had interactions with persons from the legal society, with persons from the medical society. We had youth organizations coming forward and offering services. We had psychologists coming forward and offering services. Church and community groups coming forward and offering services. I think that when we talk about the transformative new agenda, when we talk about having a whole society approach, what we can learn from COVID-19 and we can learn from our experiences last year and even going forward this year is the importance of engaging with all sectors of society, empowering them with the information on NCDs, sharing that information with them and providing the platform for them to speak up and speak out. Our messages will necessarily reach further. I think in empowering them with the information, they're able to own the message and they're able to advocate more passionately about the issues that are affecting persons, the issues in relation to NCDs. So looking at that multi-sectoral approach of combating COVID or sharing information, everyone coming on board and providing their platform for messages to be shared about COVID, or everyone sharing messages about the prevention or protection against COVID-19. Using that system of collaborating across sector, across societies, or across persons can help us then to translate the message of NCDs and take the transformative new agenda in a different way in how we share it with the public.
I want to come in here. And Sam, was that you saying something? I wouldn't.
Ladies first, please go ahead, Joy. Please go ahead.
Oh, thank you. I wanted to take that and say that we need to find ways to integrate that into regular government programming for the change to occur. We've done a lot of talking around empowering people, having advocacy, but for the change to be institutionalized and funded every year, we need to find ways to integrate that into government programming. I don't know the answer, but I think we need to find that answer and to find also a space where there is that regular interface with the newer ideas, like the ideas that are coming from Pierre and are coming from the chat and the Q&A, and to have them accepted. And then coming back to what Karen has been saying about accountability, some accountability on the new and innovating the new. So that's my 2 cents, James.
Thank you, Joy. Minister Tufton has a specific question about nutrition and the plans in Jamaica for the numbers of nutrition practitioners in schools, since currently a lot of the responsibility is placed on the cooks who are barely literate. Are there plans for strengthening institutional food personnel in schools? I guess this is something that's right across the region given the childhood obesity epidemic. Chris, are you on? Perhaps he's attending to something else. We have a question from the Dutch Caribbean seeking Caribbean experts who would like to share their experiences on improving medication compliance and participation in preventive services. And perhaps that could be followed up through HCC. The issue of leveraging, which I raised, of leveraging others, trying to find synergies with things like climate or single market and economy. I wonder if anyone would, how did you react to that, and what do you think in terms of finding something that is already a moving thing and we don't have as much of the communications challenge as we do with NCDs?
Again, if I can jump in here. So just last year with UNICEF, we had a discussion about climate change and the intersection with NCDs. And earlier last year, I was speaking with the Healthy Caribbean Coalition about how necessarily we could collaborate with UNICEF to share messages about NCDs through the climate movement. What I recognize is that the traction that climate change was getting, the importance that was placed on it, not only by young persons, but by governments across the world, it was something that I wanted for the NCD space. And I wanted to find a way to see how NCDs and climate change could intersect so that we can use the same platforms to share the same, or share our messages. What I found is that through UNICEF and through our engagement with, I think it was the Youth for the Environment program, through that engagement, we were able to have a platform that necessarily had persons from the head of UNICEF, we had persons from the WHO, and in that single space, we were able to amplify the message about NCDs and show persons the interconnection of it. What that led to is persons in the climate change space were provided with information about NCDs and how it intersects with the climate. And they're now able to champion our message and share it on their platform. So if we look at it in a worldview, we have the climate platform, which already has major traction. It's big, it's major, everyone is looking on at it, governments are making commitments to it. And then we have NCDs, which doesn't have as much attention as the government or the global space. When we have persons in the climate space empowered, informed, understand the issue of NCDs, sees how it intersects with climate, understands the importance of working on both of them, they then use their platform to share our message. And in turn, we can use our platform to share the climate message as well. So the synergy between climate and NCD is just a single example of how between movements, between advocacy movements across the world, once there's some alignment without conflict of interest, we have to be careful with the conflict of interest. Once there's an alignment that we can see, we can share those messages and empower both persons to share those messages. I believe we can get more traction and we can, again, be able to disseminate the information further and better.
James, I need to come in here. Pierre, I'm going to ask you a question. How do we control the infodemic? Because climate is a lot of information. NCDs is a lot of information. They're in 2 different compartments and ways of behaving. As a young person, how do you advise us to control that infodemic and make these messages not only coherent, but amplifying the positive? My question to you.
So one of the things that I found is in sharing messages about climate or NCDs, a broader topic that persons generally understand helps us to understand where we can fit into this, how we fit into it. So for example, the rights-based approach. Climate and NCDs can necessarily fall under a conversation about human rights. We all have the right to a healthy environment, and we all have the right to the highest attainable standard of health. Persons understand or can appreciate, I don't want to say easily, but can better appreciate the implications of their own rights. Being able to frame the climate message and the NCD message under a rights conversation helps us to condense the information into a single space where we understand that at the basis, at the outset, I have a right to both of these things. How do I get my access to these rights? Where is the government's responsibility in allowing me access to these rights? So already there's an interest of the public in terms of how do I get access to this thing? It's my right to have. How do I get involved? So then we have the attention of the persons, we have the attention of the public, we have the attention of the youth. Then it's just sharing that information in a condensed but specific way. Now that requires more effort. Condensing information in a specific way so we don't lose the impact, we don't lose the traction, we don't lose the messaging, but you also make sure that persons understand without being lost or confused what we want them to do and what they need to do to advance their causes and our causes.
Thank you.
I think, Joy, there are simple things, you know, eat less meat and a more plant-based diet, and try to bike or walk if you can. It's good for the climate and it's good for your health. That's very simple, and most people can understand it. And we could do more research to figure out how to do that, but I was struck by what you said, that they're in 2 compartments, climate and health, and that's telling, since there's so many connections. So we have to find new ways of communicating, as the young man observed. And how about economy? How can we, since we've been saying it, the 5% loss to the GDP, the loss to employers, Social Security. I was at 4 of the last 5 national health financing conferences in the Caribbean, and Social Security institutions are scared. And one of the reasons is the big NCD epidemic. And yet they're not engaging in the conversation for the most part, beside paying out. But how can they be leveraged and synergy with them be sought? I wonder if Minister's on the phone, I would love to hear his take on that. But anyone else on the panel?
Yeah, very briefly, because I think the message of NCDs has a message of promoting wellness. I think people are always afraid of the big payout, the fact NCDs last for a long time. And I think there's a lot of excitement now because people can see COVID as being a potentially intermediate term crisis that has an end in sight. But I think one has to see NCDs beyond being an interminable crisis that has no end. And we have to take the message that we still have to live as best we can. And if we can find ways to build out the message, for example, in terms of climate change, we have a right to good health, we have a right to human rights, et cetera, et cetera, et cetera. Let's find a way to engage in other platforms to allow us to achieve the highest attainable standard of health. And I think that has to be the message. Good health, decrease ill health, lack of less premature mortality. That is work in terms of having the best health outcomes. And I think unless we have that message going forward, we can never see a way through the whole issue of NCDs.
Thank you, Anselm. I'm trying to pick up on any other themes in the questions that should be drawn out at this point as we think about, the how of this transformative national agenda. And I appeal to anyone else who has a brilliant new idea on the how. We've heard some good things. So George, you wanted to speak?
Maisha is trying to bring the session to a close.
Okay. Maisha?
Thanks, Sir George. I know it's a lively conversation and we still have a captive audience, but we are conscious of time. So thank you, James, for excellent moderation, for the panelists for your excellent contributions. I think we can, I don't know if you have any closing remarks, James, but I'll leave it to you to wrap up your session and hand over to Sir Trevor. James, you're muted.
Sorry, I think, thanks, Maisha. I think we've had a really good go at it on some of the issues that would be needed to tackle in a transformative national agenda for NCDs. And we've had some good ideas as to the way forward, the role of people, the role of institutions, and so on. I'll close off and hand over to Sir George.
Thanks. So thanks very much, everyone who's taken part in this webinar. As has been pointed out, we've still got a very significant number of attendees, very engaged, but we are mindful of the hour. And so as we look to carry forward and advance this new agenda, what I've been hearing are things such as building support across CSO sectors, seeking to do so at the highest political level, aiming to engage with the healthy commodities industry. What I've also heard in this very, as I said earlier, rich discussion with many significant contributions is that we're going to be emphasizing principles of equity and human rights with a view to aiming to enhance human security and human capital. And an important aspect of our approach going forward is going to be one of social activism, with persons living with NCDs and other key stakeholders being actively engaged. But I want to close with a specific quote, if you will, from the agenda, which Maisha mentioned. And the quote is as follows, that there will be emphasize a call for informed, empowered, and self-motivated Caribbean citizens to stand up for their fundamental human right to live in an equitable world where CARICOM governments increasingly take responsibility for creating environments that support and promote human and planetary health. And so even as I very much listen to the discussion, I recognize that we've got a significant challenge ahead of us. Much has been achieved. There have been significant contributions by the policymakers. There have been contributions by civil society. And I dare say there have also been significant contributions to the effort by the private sector. What we've all got to do now, based on the experiences from the COVID-19 pandemic, is to now redouble our efforts to really achieve the Caribbean that we all want, a Caribbean in which morbidity and mortality from NCDs is significantly reduced. On that note, once again, thanks very much, everyone, for participating, and hopefully HCC will very soon again engage you in our next webinar. Thank you very much, everyone. Stay safe. Have a lovely weekend, and goodbye.